Hi, this is Dr. Perry Carpenter. I'd like to thank you for taking the time to join me on today's program. Today's program is taken right out of the hypertrophy files, and the hypertrophy files are part of a series of lectures that I produce for you doctors out of the Basic Science series for Chiropractic Continuing Education. And today's program is approved for 6 hours of continuing education in the general category by the Board of Chiropractic Examiners. So welcome to the program and thanks for joining me. I hope you enjoyed today's program quite a bit and that you get a lot out of it. The focus of today's program is going to be on two words, and these are two words that I tell almost every one of my patients on almost every single visit that I have with them. And these are some profound words, and you don't have to say really much more than these two words to your patients. And if you're able to get a head nod from your patients after you repeat this mantra to them, you'll know that you're doing the very best thing that you can for them. And this applies to you as well. Today's program is entitled Exercise Recommendations for Chiropractors and Their Patients. And so today's program is directed, first of all, doctors, at you, because I know what your life is like, and I know what it's like to be a chiropractor, because I am a chiropractor, and I've been a chiropractor for 27 years, and I know that being a chiropractor is a physical job. It's a physically demanding, it's a heavy lifting job. So we have those physical demands on us. Also, as respected healthcare authorities, we also serve as role models to our patients. So it's important that we practice what we preach. And so I direct this program first and foremost to you, doctor, and then also to your patients. And the mantra and the two words that I constantly reinforce both to myself and to my patients, and that I want to impart to you and your patients, is to up muscle. Up muscle. It's the philosophy of this program, and it's my sincere opinion that we need to continually focus on increasing the muscle mass content of our body, and this is regardless of age. In fact, as we age through our 30s, 40s, 50s, 60s, 70s, 80s, I don't know where you lie on that spectrum, but speaking for myself, I'm probably at the midpoint of that spectrum and inching perhaps slightly past the midpoint of that spectrum. And as we do age, it becomes even more important to focus on upping the muscle mass content of our bodies. So that's the whole purpose of our program today, is to learn how to preserve muscle mass and how to promote and grow new muscle mass regardless of our age, regardless of our physical condition, or regardless of any limitations that we may think that we have that prevent us from doing just that, from building new muscle. So this is called the hypertrophy files, and this is one of several lessons in the hypertrophy files, which is a series of exercise, dietary, and lifestyle techniques designed to promote muscle hypertrophy. So today we're going to talk about lesson number 1 from the hypertrophy files. And today we're going to focus on some exercise techniques involving and focusing on 3 very narrow principles. We're going to narrow this entire concept down to 3 simple, effective, and extremely powerful techniques that you and your patients can implement right away that will tremendously improve and enhance the benefits that you get from standard exercise, whether those be performed in a health club or whether those be performed at home with simple and inexpensive implements. And those 3 simple principles that we're going to focus on in this program include, number 1, the biarticular muscles, the eccentric muscle actions, and the pre-stretch principle. And of course, we'll elaborate over the next 6 hours on these 3 principles. So if you're ready with me, I'd like you to grab your handout materials for your note-taking benefit. Grab you a snack and a drink and get ready to get down to some brass tacks of anatomy, physiology, and the science behind muscle hypertrophy. Now, due to time constraints with this program, I want to now move on to some exercise applications for the lower extremities, and I just want to let you know that what we did with the upper extremities is really just the tip of the iceberg. We didn't consider many different exercises that we could apply to the shoulders, to the elbows, to the wrists, and the hands, all of which incorporate the principles that we've been discussing here. However, due to time constraints and to give you more examples of how these principles can be applied now to the lower extremities, I want to move on. And with regards to the lower extremity, we're going to consider and review the joint actions of the lower extremities. We won't have time in this program to discuss every single possible exercise and every single possible joint action, but like we did with the upper extremities, I want to highlight a couple of the key and common exercises that you'll find in local health clubs and show you the modifications and enhancements to those exercises to incorporate the hypertrophy principles. So with regards to the hip, we're concerned with flexion and extension motions in the sagittal plane, adduction and abduction maneuvers in the medial plane, in the coronal plane, and then medial and lateral rotation movements in the transverse plane. With the knee, we're concerned with with knee flexion and extension movements. With the ankle, we're concerned with ankle plantar and ankle dorsiflexion movements. And with regards to these 3 major joints of the lower extremity, for the purposes of today's program, we're going to focus on exercises involving hip extension, and then also knee flexion and extension. And then, with time permitting, we may also have some time for some demonstrations of exercises involving ankle, plantar, and dorsiflexion. Additional actions that we can explore and that you should construct exercises for your clients and also for yourself in order to be erring on the side of comprehension is to include exercises also for the feet, which are especially important in the rehabilitation population, because if you're a practicing chiropractor, you know that foot pain and toe pain conditions are almost ubiquitous in the over 40 and certainly in the over 50 population. So there are many different exercises that can be constructed to promote hypertrophy and muscle strength gains in the ankle and foot, and I don't believe we'll have time in this program, but I look forward to addressing those exercises perhaps on a future program. So for now, and for the balance of this program, let's consider some hip extension exercises and other exercises associated with the lower extremity. When it comes to hip extension, there are many muscles that contribute to hip extension. Now, the prime mover for hip extension is the large gluteus maximus muscle. And the gluteus maximus muscle is assisted in hip extension by the hamstring muscles. And the hamstring muscles are many. In fact, there are 4 muscles that comprise the hamstring muscles. And of those 4 muscles, one of those 4 is unique in that it has a different attachment or different origin point than the other 3 hamstring muscles. So the hamstring muscles consist of the biceps femoris, long and short heads, the semitendinosus muscle, and the semimembranosus muscle. Now, the long head of the biceps, along with the semitendinosus and along with the semimembranosus, all three of those muscles attach on the ischial tuberosity of the pelvis. Now, the ischial tuberosity is located on the pelvis. Recall that there are three bones that make up the pelvis. There's the ilium, the ischium, and the pubis. And the ischial tuberosity is nothing more than a bony prominence on the ischial bone. The point is that these muscles attach not on the femur, but on the pelvis. And so therefore, these muscles cross the hip joint and act at the hip joint. Now, we already discussed how the hamstrings act and insert below the knee, and we'll elaborate on that a little bit more as we get down to the knee. But for our purposes here now, let's consider the function of the hamstrings muscles as relates to hip extension. So 3 of the 4 hamstring muscles attach on the pelvis. One of the remaining hamstring muscles, which is the short head of the biceps femoris, that muscle attaches on the femur bone, or I should say it originates on the linea aspera of the femur bone, on the distal 1/2 of the femur bone. And then all 4 of the hamstring muscles attach below the knee, with the biceps femoris attaching or inserting on the head of the fibula and the lateral condyle of the tibia, the semitendinosus inserting onto the upper medial surface of the shaft of the tibia, and the semimembranosus inserting on the posterior medial condyle of the tibia. So as you can see, at least 3 of the 4 hamstring muscles are bi-articular muscles, meaning that they attach on the pelvis, cross over the hip joint, and then attach down onto the tibia and the fibula, thereby crossing the knee joint. So these hamstring muscles are going to have actions at both the hip joint and the knee joint. And for our purposes now, let's consider the action of the hamstring muscles on the motion of hip joint extension. Okay, so for those of you that have the PowerPoint presentation, I have here a diagram of the hamstring muscles, and I like to direct your attention first to the diagram on the right, which shows an intact gluteus maximus muscle, and the large gluteus maximus muscle is the prime mover for hip joint extension. As you can see, it attaches or inserts down onto the iliotibial band and also onto the greater trochanter of the femur bone, thereby crossing the hip joint and serving as the prime mover for hip joint extension. Now, if we dissect away or reflect away the gluteus maximus muscle, that exposes the deeper and underlying hamstring muscles, consisting of the semitendinosus, the semimembranosus, and then the 2 heads of the biceps femoris. And I draw your attention here by way of laser pointer to the common attachment or origination point of 3 of the 4 hamstring muscles on the ischial tuberosity. And then those hamstring muscles then extend downward and cross the knee, both laterally here in the case of the biceps femoris, and medially here in the case of the semimembranosus and semitendinosus muscles. So therefore, the action of the hamstring muscles is to, number 1, flex the knee, and also secondarily to assist in extension of the hip joint, or hip joint extension. Okay, so let's go over some exercises now that involve primarily hip extension. And again, it's going to be the gluteus maximus and the 4 hamstring muscles that are going to be our hip extender muscles. And I'm going to let you know now in advance that you're going to get a good workout here on the hamstring muscles, because in this next sequence where we demonstrate hip extension exercises, we're going to be hitting the hamstring muscles. Well, later on in the program, when it comes to exercises that involve knee flexion, we will also incorporate the hamstring muscles. So prepare for a good hamstring muscle workout. Now, the first exercise that I want to share with you as relates to hip extension is the good morning exercise. And this is an excellent exercise that fulfills many of the criterion that we've established for hypertrophy training, in that the good morning exercise is a multi-articular exercise. It uses the multi-articular hamstring muscles, of which there are 3 that are multi-articular. It does allow a pre-stretch to passive insufficiency, and it also does have the capacity for incorporated accentuated eccentric muscle actions. Now, just a couple comments on the good morning exercise. Many of you out there may have done the good morning exercise or may be familiar with the good morning exercise. And I've been familiar with the good morning exercise for decades, probably. Probably more than 35 years ago, I was first shown the good morning exercise, and I've done the good morning exercise over the years, mostly early on in my career in weight training. And for many years, I discarded the good morning exercise because as a chiropractor, it just seemed to me that this was an exercise that involved high risk for injury to the lumbar spine and relatively little benefit. In other words, the risk reward ratio didn't quite factor out for me as a chiropractor, and I felt that there were other exercises that would give more benefit for less risk, and so I discarded the good morning exercise for years, for decades. And I recently became reacquainted with the good morning exercise, and I've changed my opinion on it completely. And that is that the good morning exercise is an excellent exercise for the hip and lumbar spine extenders, and it is a very safe exercise if it's done properly. And it's actually one of the very best exercises for the glute max and the hamstring muscles. And so I want to demonstrate the good morning exercise to you and narrate some of the key facts and features about this exercise that make it so excellent. Okay, so let's go through the good morning exercise now. I'm going to roll this video and I'll narrate along as we go. Now, as you know, the good morning exercise involves the weight bar here.
Yes, please.
We're going to place that behind our neck, and feel free to use a pad if you're training clients or patients. Make sure that they put a pad here that cushions their cervical spine. So this is going to go behind the neck, and then the movement simply involves a flexion of the hip socket. Now, the lumbar spine remains neutral by way of an isometric contraction of the spinal erector muscles. Now, you'll notice that when you observe this good morning exercise being done properly, there's absolutely no movement or no flexion of the lumbar spine. And the reason there's no flexion of the lumbar spine is because the lumbar lordosis is maintained through an isometric contraction of the lumbar paraspinal muscles. The entirety of the movement occurs only at the hip joint. Now, as the hip joint goes into progressively greater and greater angles of flexion, there comes a point in time when the hamstring muscles are lengthened across the hip joint to their maximum length. This is the position of passive insufficiency of the biarticular hamstring muscles. When passive insufficiency occurs, then reflexively the knee must bend in order to relieve tension on the tightening hamstring muscle to allow further flexion of the hip. And you'll observe the point at which passive insufficiency occurs in the video, and I'll point that out to you here. So let's roll the video. And here comes our subject. The bar is going to be positioned behind the neck, comfortably on the trapezius muscles. And then the movement occurs purely at the hip joint here. Notice, this is hip joint flexion only. The lumbar spine remains in neutral through an isometric contraction of the lumbar paraspinals. And you'll notice here there's flexion also at the knee as the hamstring muscles reach passive insufficiency. That signals the point at which the range of upward motion begins. And this is an excellent exercise involving extension of the hips using the gluteus maximus and the 3 of the 4 hamstring muscles. Now our subject is applying an intensity technique known here as a drop set. He did first 10 repetitions with one weight, now has removed a little bit of weight and is continuing with additional repetitions. And notice that the flexion occurs only at the hip joint. The lumbar spine, none of the lumbar spine vertebrae move at all. So as long as there's no flexion of the lumbar spine, this movement is actually very safe. The greatest amount of injury that could possibly occur would be a strain of perhaps interspinous muscles or supraspinous muscles. But again, those are very strong muscles, and this is actually not a heavy load. So it does call into importance the necessity of properly selecting the load because of the long lever, but it's a very effective exercise in my opinion if done properly. And note the passive insufficiency of the hamstring muscles, which causes a reflexive flexion at the knee. If the knee did not flex, there would be less less hip flexion, because the hamstring muscle simply does not have the length to allow full lengthening over both the hip joint and the knee joint. Okay, so that's the hamstring that's the good morning exercise. Let's go on to the Romanian deadlift exercise, which is a similar exercise to the good morning exercise, but in my opinion a little bit more user friendly and perhaps a little bit more applicable, especially to beginners and or those that may have a history of lower back, lumbar spine conditions. So the Romanian deadlift is an excellent exercise. It involves the multi-articular hamstring muscles. It does allow a pre-stretch to passive insufficiency, and it does lend itself to accentuated eccentric contractions. However, those are a bit awkward, although not impossible, and traditionally this exercise is done simply without the application of the accentuated eccentric component. Okay, so with the Romanian deadlift, again, it involves simply hip flexion and extension. You will note that the hamstring muscles arrive at passive insufficiency as the hip flexion angle progressively increases. And then the upward motion is purely a motion through contraction of the gluteus maximus and the hamstring muscles. So let's roll the video on the Romanian deadlift. Subject here has 135 pounds on the bar, and notice that the hands track right down immediately in front of the shins to minimize the length of the lever or moment arm of the weight. The movement is a pure hip flexion exercise. Lumbar spine remains straight through an isometric contraction, and then the knees reflexively bend as the hamstrings reach passive insufficiency. These are very strong muscles, and this is very safe exercise if done properly according to the guidelines that I just recommended. And primarily, that is that the lumbar spine remain in a normal lordosis through isometric contraction of the lumbar paraspinal muscles. So those are among the very best of the best exercises for the hip extensors. In a short time, we'll get to some additional exercises for the hamstring muscles, as the hamstring muscles act at the knee to promote knee flexion. In conclusion, this is Dr. Perry Carpenter. I hope you enjoyed this program. Now you have a 20-question examination that I need you to complete and either fax or email back to me. My fax number is on the top of the examination form, and just as soon as I receive your examination form, I will provide you with a certificate of completion that you can use for your Board of Chiropractors continuing education credit. For now, I want to leave you with the website for chiropractors, which is entitled Chiropractic.com. We're always coming up with new programs, so check the website frequently for new programs designed to help you succeed as a chiropractor. Again, Dr. Perry Carpenter wishing you great success. If there's ever anything I can do to help you, feel free to call. Again, thanks for being with me on this program, and best of success.